We're talking mental health with Minister Michael Tibollo, the Associate Minister for Mental Health and Addictions. Yeah, it's James with Net News Ledger. Joining us, courtesy of Zoom, is the Minister for Mental Health and Addictions for Ontario, Michael Tibollo. Michael, thanks and welcome back to Net News Ledger.
It's a pleasure to be here once again. Thank you.
We are doing a lot of work in Ontario, especially through COVID-19, on mental health issues. Earlier in the week, there was an announcement on mental health. What do our readers and viewers need to know?
Well, I guess the first thing that they need to know is that we're listening, we care, and we're trying to ensure that we build as many supports and services throughout the province as we possibly can, given the needs of the people of the province. And that includes the remote far north, it includes our rural communities, and of course it includes all our cities. So we're here to make a difference and make sure that we make the investments necessary to build a system that's connected and accessible to absolutely everyone in the province.
Now, in the announcement, there's funding for 6 professionals across how
Yes.
far in Western and Northern Ontario?
Well, this is for Northwestern Ontario. It's the funding for 6 psychiatrists that will be employed in through Thunder Bay. It's an investment of $1.5 million to get 6 psychiatrists that will work through the child and adolescent multidisciplinary psychiatry services, so the CHAMPS program. And it's going to start at Thunder Bay Regional Health Science Center in partnership with St. Joseph's Care Group, and provide us professionals that are not only going to be able to man the hub that we're developing in Thunder Bay, but also be able to then reach out into the remote communities and provide those additional supports and services.
So is there going to be additional funding for, one of the things probably people in, say, the Greater Toronto area or Southern Ontario don't realize is that from Thunder Bay up to, say, Washoe Cree Nation or Fort Severn, we cover an area in our region about the size of France.
Yeah.
It's a huge area, and just traveling into a northern community often requires an air flight of several hours, but it's also expensive flying in the north. Will there be funds available for that travel?
Well, the funding for this is actually for the psychiatrists, and as part of the plan, obviously, it's to ensure that they're able to reach the remote communities. I mean, I've had that experience of flying into Thunder Bay and waiting overnight to catch a plane to Sioux Lookout to get me up to Pekanjikam and then up to Sandy Lake. And there were some mechanical difficulties, and as a result of that, ended up spending the day just touring around Thunder Bay, and drove for hours and came to Red Rock, only to see a sign that says the next community is 400 and something kilometers away, and the next one after that is another 800 and something kilometers away. So you're right. A lot of us in Southern Ontario have no idea the vastness. But the need is there. And what we want to do is ensure that we do provide the best supports and services within the local communities, because we know that that gives us the best results in the long run for people that are suffering from a mental illness or from an addiction issue.
Now, one of the things, and I remember the first time I attended a powwow here in Thunder Bay, one of the elders told me, and he said, real simple, back in the day, we didn't need psychologists. We didn't need psychiatrists. We had the drum. And the culture is so key in this. Is there going to be cultural opportunity to get back to traditional Indigenous culture through this program?
So, James, I'm a huge believer in culturally appropriate supports and services. If you look at the roadmap to wellness, not only are we looking at the lifespan, so the different developmental stages of a person's life, what we're also looking to do is create that step care model to the greatest extent possible within the local community. But for me, the most important part of the entire plan is the delivery of culturally sensitive services. When you talk about the Indigenous communities and land-based healing, those are things that we know work. Now, there's a lot of work that still needs to be done to back up, because evidence-based supports are what we're trying to create, and we're trying to learn more. But there's an incredible wealth of knowledge in the Indigenous communities that's been untapped forever. I can give you examples. I think I've mentioned once to you that I'm doing my doctorate in clinical psychology with a
Mhm.
focus on residential treatment. The interesting thing about residential treatment is most people think that it started in the 1960s in California with Synanon, and that we somehow invented this. Well, we didn't invent it. Over 2,000 years ago, indigenous peoples of this land were using residential treatment as a way to dealing with some of the mental illness issues that some individuals were facing. And that tradition of land-based healing has been in the communities for the longest time, but it's never been properly studied or properly invested in. And that's something that I'm very interested in doing, because I know the benefits. I've taught the spirituality to non-Indigenous people and Indigenous when it's come to helping them with addiction issues. I know it works, and I'm excited to do more. And yes, so the psychiatrists will be working with local service providers that are Indigenous, and we're going to use the best of the best services to make sure that we're giving culturally sensitive and appropriate services to Indigenous people. And as far as I'm concerned, I want to fund the programs, I want to turn it over, and I want to see Indigenous people helping Indigenous people, because at the end of the day, right, to build that therapeutic alliance, that trust, it's much better and much easier for someone Indigenous to help someone that's Indigenous. So we're going to work really hard to do that, to create the level of expertise to be able to deploy individuals to do the work in their communities, because I know we're going to get a really good result that way.
And Minister, with that, I think we'll shift to our and look forward to talking to you next time.
Thank you. It's great being with you again.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.